All right, so we're going to go over some of the bony landmarks for the proximal tibia and fibula. So starting with the tibia, we have our tibial plateau. So that can be divided into medial and lateral. So if you ever need to figure out which side of the tibia is lateral, just look for the fibula. So this is our lateral tibia plateau, and this is our medial tibia plateau. And so that's going to be where your menisci are. Now we also have our condyles. So we have our lateral condyle right here, and then we have our medial condyle right here. And then directly center of that, we have our awesome tibial tuberosity. And if we look back where the condyles and the plateaus are, you have these two like almost cat ear prominences in the center, and that's going to be your intercondylar tubercles. So these are super important to know just because they're involved in a lot of ACL ruptures. When you have the torsion of the tibia, the intercondylars almost like cleave across and sever your ACL. So definitely important to know. Back down by the tibial tuberosity, if we move more lateral towards the fibula, we have what's called Gerdes Tubercle. That's going to be where your IT band comes across and inserts right there. If you need a way to remember it, Gertie kind of sounds like an elderly person's name, and there's a little like cane right by it, so that's how I remember it. Gertie has her cane right next to her, so it's on the side of the fibula. If you move more medially, that's where your pes anserine is going to be. That's going to be the sartorius, semitendinosus, and gracilis all coming down and connecting right through here. Now, if we go to the posterior side of the tibia, one important landmark is going to be your soleal line. If you look this little red mark right there, there's a ridge, and that's where your soleus is going to originate before it goes down towards your calcaneus. We also have your interosseous borders. That's just going to be the medial side of the fibula and the lateral side of the tibia, and that's where your interosseous membrane attaches. Now we move on to the fibula. You have your fibular head, which is going to be the most proximal part of the fibula. And at the very top, you have what's called the apex. If you think of like a mountain has its apex, the fibula has its little apex, which is the most superior proximal part. You also have the neck of the fibula right here. Then you have the shaft of the fibula going all the way down. And then at the ankle, of course, you have your malleoli.